Good morning, everyone, and welcome to our webinar today. The topic today is Sundowning syndrome in persons with dementia, and we're bringing back one of our very popular speakers today, and I'll tell you about her in just a little bit. But first, I would like to take a moment to thank our sponsors. Thank you, Care Choices, Hospice and Palliative Services, O'Connor Mortuary, Caring Companions at Home, and Alzheimer's Orange County. And my name is Kim Bailey. I'm with Alzheimer's Orange County, and I will be your host today. And I'm very happy to be your host today, I should say. Our sponsors are providing these webinars to us as a service to our community on topics that are beneficial for anyone who cares for and works with older adults. We hope you'll find today's presentation especially informative and useful. And our presenter is going to be Erin Palposi. Before I introduce her, let me go over the requirements for you to get your CEs. Okay, so CE credit is available for RCFE administrators, licensed RNs and LVNs, and for LMFT, LCSW, LEP, and LPCC professionals through CAMP and the BBS. You must be online for the full 60 minutes and have access to both audio and visual elements on your computer. If you want CE credit, do not share your link to join with others. This is your unique record of attendance. And if you share it, you won't get credit for your CE. So please answer the poll questions. There'll be a series of them in the lecture today. This is proof of your active attendance. If for any reason you have difficulty accessing or answering the poll questions, simply type your response into the chat box just to let us know that you're having difficulty and so that we can give you credit for your response. Please complete the survey immediately as you exit the webinar. Uh, you will only receive a link for that survey by email if you don't complete the survey when exiting. The email with the survey link is sent out 24 hours after the end of the webinar. And again, this link is unique to you, so don't share it or you won't be able to get credit. So a certificate of completion will be issued to you by email within 10 days as long as you have met all of the requirements. So some basics for everyone. Your mic and video are automatically disabled and will remain so throughout the presentation. However, you will have the opportunity to interact with the presenter. At the end, we've saved some time for Q&As, so you can put those questions into the chat box as we go along. If for any reason the Q&A runs long, you're welcome to stay for that, but if you're requesting CE credit, you're only required to stay for the 60 minutes. So we're not going to be responding to raised hands unless we ask you to raise your hand for a specific reason. And again, please remember to complete the survey as you immediately as you exit the webinar. So, okay, with all that out of the way, I'm happy to introduce our speaker today. Again, it's Erin Palposi. She is the executive director at Kirkwood Orange, an MBK senior living community in Orange, California. She's a gerontologist with 11 years of experience specializing in dementia care and supporting the needs of older individuals, and also advised master level social workers at Silverado Memory Care Communities nationwide. She received her bachelor's degree in cognitive science from UC San Diego, after which she worked in dementia research in a joint UCSD/Veterans Hospital venture researching mild cognitive impairment in older veterans. Erin obtained her master's degree in gerontology from USC and became the graduate researcher on a joint Silverado Senior Living slash USC study exploring the effects of daylight in reducing depression in memory impaired adults. Erin also holds a residential care for the elderly administrator certification and a dementia care specialist certification. She also completed Vance Caesar's Leadership Development Program. Erin's passion for older adults experiencing memory loss stems from supporting a grandparent with dementia in a caregiver role during her adolescent years. Erin has extensive experience hosting support groups for various populations, including family members of individuals with memory decline, and she also participates in speaking engagement on executive functioning and cognition. And so I'm very pleased to turn this over to our wonderful speaker, Erin Palposi. Thank you for being with us again today, Erin. We love having you.
Thank you, Kim, and Alzheimer's Orange County. It's such an honor to be back with you today, and especially for this really important topic. Nice to see all of you out there. So, we're looking forward to spending some time together. And we're going to be reviewing sundowning syndrome or sundowning in persons with dementia. So, let's start off with the basics. What is dementia? Dementia is an umbrella term describing a variety of diseases and conditions that cause damage to the brain, resulting in loss of cognitive ability. So, this is important to note. It's not part of the normal aging process. So, when I forget my keys in the morning or forgot what I had for breakfast yesterday, right? That's pretty typical. This is more slow and progressive. It starts with mild symptoms and then progresses over time. Alzheimer's disease is the most common form of dementia. It actually makes up about 60 to 70% of dementias. So there's a lot of different types of dementias. We're only going to go over a few of them here. There's over 120 in general. There's irreversible and there's reversible types. So, in the irreversible category, some of these you might have heard about: Alzheimer's disease, Lewy body dementia, frontotemporal dementia, Pick's disease, vascular, Parkinson's disease, Huntington's disease, and CTE. These are often, they progress over time. Reversible are dementia that can be recovered with interventions such as medications or treatments or just time itself. So, some ideas would be you can have cognitive impairment and dementia from depression. You can have it from drug interactions, nutritional deficiencies, thyroid disease, infections like a urinary tract infection, a UTI. Also, can be due to anesthesia and surgery. These symptoms for these can be very dementia-like. Real quickly, we're going to review the changes associated with Alzheimer's disease and dementia. So the most common, the most talked about, of course, is loss of memory. Another one that's very prominent and often happens in the earlier stages is loss of language or communication changes. You might have heard this called aphasia in some of your loved ones, right? So sometimes early on, it's very difficult for individuals experiencing memory loss to verbalize what's occurring and sharing how they're feeling. They might have word salad where they can't express themselves as clearly, or their verbs and their nouns might be in different spots in sentences, or maybe they're having difficulty identifying people or things. Additionally, loss of executive functioning. This often occurs in the frontotemporal lobe of the brain. So, functions such as reasoning, judgment, abstract thought, these are very common and can sometimes lead to impulsive or very quick behavior. Other changes include visual spatial perception changes and behavioral changes. So, some of you may have heard of a part of the brain called the hippocampus. So, the hippocampus is responsible for working memory. It also creates new memories by putting them into long-term storage, and it also retrieves memories. The hippocampus for Alzheimer's disease specifically is where a lot of the decline starts. And so even 10 to 9 to 10 years before someone starts showing symptoms of Alzheimer's dementia, for example, this part of the brain can have up to 20% volume loss, right? And so if you think about how we take care of ourselves and even that progress, how that affects the rest of the brain. So if you have a loved one who is in this process and they're having difficulty identifying you, right? They know that you're a family member, but maybe they can't say daughter. They just know that you're a family, right? So this part of the brain that's retrieving information from long-term storage is having a lot of difficulty doing this. Dementia can feel very devastating, and I want to just give you an example of how this is going to be affecting you if you have a loved one with this, right? Think about any other organ in your body. If you have issues with your heart or your lung, it's not really affecting your personality as much. It's not affecting your identity. You're still you, you still have your person. But if we are having difficulty cognitively, right, that's affecting how we interact with relationships. That's affecting how we communicate. And so it's really impairing and damaging. We feel like we're losing a part of them when this happens, right? So oftentimes, as we're grieving loved ones or friends who are going through declines and different dementias, this is why it often feels more devastating sometimes early on because they're changing so quickly. Now let's dive into the term sundowning and how it affects behavior, right? This sundowning syndrome in general is a disruptive group of symptoms. It often occurs in the middle and later stages of Alzheimer's disease and some other forms of dementia. It's not a disease per se, but a group of symptoms that occur at a specific time of the day among Alzheimer's disease and sometimes vascular and mixed dementias. Can also be referred to as late day confusion. So people may experience a state of confusion, agitation, aggression, and it might occur in the late afternoon as the day progresses into the evening and the nighttime. At a time when most people are expected to be winding down, sometimes people experiencing sundowning are actually ramping up and becoming more active, right? So they might not know whether they're coming or going. They might not know, are they leaving for work? You know, if I just took a nap, am I getting up? Am I restarting my day and expecting breakfast at 5 o'clock in the afternoon? Should I be going home? Right. So all those changes are really strongly affecting them. We don't really know, unfortunately, the causes of sundowning. It's not known with certainty what the underlying cause is. However, there are some theories, and some of them are here. One theory is it's an accumulation of sensory stimulation that's built up over the course of the day, which results in high level of stress. And for those of us who don't have any dementia, you can think about how tired you get at the end of the day, right? Some of us need that 2 or 3 o'clock extra cup of coffee once in a while, or we might just kind of be overwhelmed and have some sensory overload, or not really wanting to talk too much towards on our drive home, right? We just kind of want to de stress. So that's one theory. Another theory is that there might be a hormonal imbalance that occurs at night, which affects the person's natural circadian rhythm. And we're going to talk about later in this slide presentation about how daylight early in the day helps prevent this. Another theory is that it could be fatigue building up over the course of the day. It could also be anxiety caused by the inability to manage the dark. So changes in natural light associated with the time of this time of day can be very disorienting.
Okay, it's time for our first poll question. True, false. It is not known with certainty what the underlying cause of sundown syndrome is. Again, it is not known with certainty what the underlying cause of sundowning is. Is that true or false, audience? Give it just a couple more seconds. Let everybody weigh in. And It looks like we're there. So let's go ahead and release those results. And almost everybody got that right. So good job, audience. And now back to you, Erin.
Thank you. All right, so now we're going to take a look at the symptoms of sundowning. This is more of the meat of the presentation, what we're going to discuss. We try and categorize these and group them into three groups. So mood changes, cognitive effects, and behavioral expression. So let's take a look at mood changes first. Sometimes it feels like there's a switch that's been flipped, right? There's very pronounced mood changes. One time they might be nice and calm, and then the next minute they could be anxious or pacing or agitated, maybe even crying or emotional. Um, they might have aggression. This is often presented as restlessness, and you might even see increased fear and paranoia. Some of the cognitive effect symptoms include we look for visual and auditory hallucinations. So you might have someone who is looking at themselves in the mirror and they don't recognize themselves and they think somebody else is there. And so they're wondering who's in my house. It could be a reflection, they could be hearing something, it could be a noise that they're associating and they think it's a person's voice. There might be some delusional thinking and disorientation of where they're at or what's going on, and also confused about the identity of other people, right? So if you think about the deterioration of the hippocampus, if it hasn't been working up to maybe 5 to 10 years before symptoms even start, they might not have been able to input enough memories of what you look like at this age. And so oftentimes when residents at our community are declining, their families say, Mom doesn't recognize me anymore. And sometimes we can show them a picture of their child or their spouse at a younger age, and they'll say, Oh, that's my husband. Oh, that's my daughter. But they don't recognize them at their current age because they're confused about what they look like currently, right? So they're able to identify them correctly just at an earlier date in time when their memories are not as affected and they're stored better in long-term storage. So that's something to keep in mind. Some of the behavioral expressions, right? Sudden unexplained changes in behavior, inability to respond to reasoning, or it might come off as stubbornness. I want to stop and talk about this word inability, right? So we think, oh, if only they can relax, or if only they could remember, right? And so the story that I share with families who are coming to our community, or if they're watching their loved one decline with some type of dementia and they might have some symptoms of sundowning, the example I share is I have a lot of allergies, right? So when I go to the doctor, I'm expecting they're going to help me, right? I'm allergic to a lot of things, grass, cats, dogs, pretty much any plant that, right? So I need help. And so I want the doctor to give me something, right? He might give me a shot or he might give me some medications to make the symptoms less. But what I don't expect the doctor to do is tell me, Erin, just tell your body to get over it. Just tell your body to stop reacting to the allergies, right? And so we need to think about this from this perspective of our loved ones or our friends who are experiencing dementia, right? We can't just tell them, hey, just tell your brain to pull it together here, right? And act correctly, because we know that if they didn't have this disease process or this illness that was affecting them, they would still be acting like their current selves. So just extending some grace to our loved ones, right? It is an inability. It's nothing that they can fix and it's not their fault. And they're not trying to make others around them frustrating, even though sometimes we feel burnt out as caregivers. And we'll talk about that a little bit later too. Some other behavioral expressions include sleep disturbances, so the inability to sleep at night. They might get up early. We often hear times, "Oh, my husband, he's up for work at 2 o'clock and he's showered, and I'm trying to get him back to sleep. And by the time he gets back to sleep at 4, and he's up again at 4:30 and ready for work and wants to shower." And he's been retired for 10 years, right? So these things are very cyclical, and it does affect them and their loved ones as well. Other behavioral expressions include trouble speaking and thinking clearly, could be hiding things, right? Putting things in unknown spots. Also could be rocking and pacing and wandering. Okay, so some of the risk factors for sundowning behaviors. Did you know 20% of people with Alzheimer's disease experience some level of sundowning behaviors? That's a lot. That's one in five, right? So again, usually mid to late stages. And some of these risk factors that make this more prominent include a history of alcohol or substance abuse, which can lead to more severe symptoms, changes in sleep patterns, lack of sleep and wakefulness during the night, which we mentioned briefly, difficulty separating reality from dreams. This one also can be from TV. When we had the fires a couple years ago at a community, we had some residents who really thought the fires were happening in real time at the community. And this is a real fear. So sometimes when we're putting on the news, it's hard for individuals experiencing sundowning to distinguish if it's happening there or if it's happening in real life and if they need to be afraid or not. And sometimes that provokes some of the anxiety and that restlessness and that fight or flight or aggression even. Stress caused by unusual events, right? Such as visiting the doctor. So, normally, most of us probably don't enjoy going to the doctor, but if you are even a little bit aware that you're having trouble answering questions, right? Simple questions that you'll get asked during a cognitive test or a quiz might be, what's your birthday? Or what'd you have for breakfast? Or what state are we in, right? These are embarrassing questions to ask in general because we should know them. But if you don't know them, they're even more frustrating and they're even more embarrassing, right? And I know with sometimes house call doctors that can go to your house, sometimes that helps a little bit to reduce that. And I know at some of our communities, we ask physicians who are coming in maybe not to wear their doctor's coat, right? If we know that there's a risk factor of someone who's hard having trouble separating that reality and is going to be more stressed out by that. Another risk factor includes caregiver stress or frustration, right? So going back to that inability, right? Our actions are going to influence the behavior of that person who's experiencing dementia. They're not trying to forget, but us saying, hey, why don't you remember? We just did this, right? We just ate dinner. Why are you hungry again? That doesn't help, right? And so we could maybe we're sighing or rolling our eyes, just waiting for them to stop telling us that story that they've told us 8 times in the past 2 hours, right? So it's just really important to remember that our loved ones aren't trying to do this on purpose. There's something wrong, and it's important for us to check ourselves and to make sure that we're taking care of ourselves and taking breaks as well, because this is a real struggle, and it's a marathon. It's not a sprint. What about some of the triggers, right, that can aggravate sundowning behaviors? So, on the environment, low or dim lighting. If you have a loved one who doesn't live with you and they're still at their own house, I bet you sometimes when you go to their house that they have all the lights off, right? And sometimes if they're forgetting to turn the lights on, that's going to even more could potentially trigger sundowning if they're not having as great of light. Increased shadows like a curtain blowing or the steps going down a stairs that are going to be really hard for them with depth perception, noise and distraction, right? So sensory overload, we hear a lot of time. This is a big trigger. And the story I like to share is of a family friend who was just he was the life of the party. He wanted everybody at his house for Super Bowl events, excuse me, and he loved having everybody over. We cram his house full. And then all of a sudden, the last couple years, it started to get too much for him. And we would say, hey, we'll call him Bob. Where's Bob? And Bob would be in his study. And, he's supposed to be front and center in his favorite couch at his favorite seat. And it was just too much and he needed to go away. And so we hear that too oftentimes from families that are taking their loved ones home if they're newly at assisted living or at a memory care community, that they'll say, well, we started dinner and we all started talking and we were thought we were having a good time and mom got up and said, I need to leave. I need to go home. I need to get back to my routine, right? So strange or unfamiliar settings or surroundings that again have multiple layers on top of them, it's a lot for them to process cognitively, right? Like think about hearing underwater, right? It's garbled, it's not going to be processed well, and there's just too much sensory overload. Additionally, clutter is another one that's a big trigger, can cause confusion and increase risk of injury. This could be something as simple as there's mail that we bring in from outside and it's on the table. And now grandma thinks that she needs to pay the bills. And so she's rifling through the mail and she's opening things and she's getting stressed out because she feels like she's responsible for what's happening and she doesn't know how to process it, right? Whether she might not have financial access anymore or just doesn't even know how to work a checkbook, right? So all these things can add up in the winter time too, right? There's shorter days, less exposure to natural light. You may have heard, especially in the northern hemisphere, they do a lot of studies on how sunlight affects depression and how people who are seated in offices with big windows have less depression. And so that's something that we will discuss in a couple of slides as well. Some other triggers that can aggravate sundowning behaviors on the individual level include fatigue, illness, or presence of an infection, such as a UTI, right? Some of these behaviors can overlap. So the anxiety, agitation, restlessness that we talked about before that could be symptoms also are behaviors that are symptoms that could come from a UTI as well. Another one could be poor vision. So, if the person does not see shapes clearly, they may experience some visual hallucinations. New medication or changes in medication, medications wearing off later in the day, right? So, if mom takes a pain medication in the morning for her knee because her knee's always had pain or her back's always had pain, that's going to wear off and she might not remember to take it later on that day. And sometimes medications can also mask pain. And so then we don't really know what's going on, right? We don't know if mom's just cranky, is she sundowning, or we just need to get that Tylenol back in her to help her knee pain that she's had chronically for the past 20 years. And something that we hear quite often is, oh, yeah, mom has severe back pain in her lower back for the past 2 decades. And as soon as she got diagnosed with dementia, she and her dementia increased and she started to decline. She stopped complaining. So she doesn't have knee pain anymore. She doesn't have back pain anymore. Well, we know that's not correct, right? So those routines that we need to help keep them in, that can also trigger some of the sundowning behavior that's we're talking about. Any changes in the daily schedule or routine, those are really tough and really difficult to help one keep a calm demeanor as well with sundowning behavior. So creating a good routine for yourself and your loved ones is really important. Sometimes triggers can also be something that reminds the person of a time when they were younger. They might be expecting a spouse to come home. Oftentimes, we hear at our MBK communities that residents are looking for their children, right? And so we try and enter their reality a little bit and say, oh, how old's your child, right? So if I know someone's looking for a 5 and 7-year-old child who, it's Thursday, they should be at school, right? So that's probably the reality that they had at one time in their life when they were having children. But I know their adult children are in their 50s, right? It doesn't matter because they're still experiencing it as if they're looking for a lost child. And for those of us who have kids, that panic of not knowing where your child is very real, right? So trying to redirect them with a snack, or trying to get them distracted from finding their child is going to be very difficult because that's a fight or flight response for a parent, right? Other triggers could be the times that they need to cook meals going to work. A lot of residents will try and leave, whether it's their house or they'll try and leave the community when it's time to go home. And they say, well, aren't they happy here? Well, of course. But for the past 35, 40 years at their job, they've gone to work at 9 o'clock and they left for work around 5. And so they've had that habit for decades. And so they're continuing that very strong routine. And their brain is telling them, hey, the sun's going down. It's time to go. Right. So that is something that we can look for in those individual triggers. And you might be thinking of someone who does this right now. There are some dangers of sundowning behavior, right? It does increase the likelihood of injury from falling. So some of this stress and anxiety can make individuals experiencing dementia move quicker, right? So paranoia, trying to get away from a sound, or if they think somebody's in the house, they could be moving quickly and impulsively, and it does increase their likelihood of a fall. They could wander and become lost. This happens pretty frequently, um, especially in Southern California where the weather is nice and, afternoon walks are very common. Sometimes you have individuals who are very healthy and very active. And we had one lady who said her husband used to go on a jog, and into his 70s. He always jogged, even from a young child. In high school, he was on the track team. And this was just part of his healthy lifestyle. And one day he just didn't come home. And they had to go find him. And then she called our community and said, hey, I need help. I need to move dad into the community or her husband, because he got lost and he wandered off and he couldn't find the street that he's jogged down 30 years in a row, and just couldn't make it home, right? Another danger, right? Loss of sleep can cause symptoms to worsen. So just think about how tired we get, with clear thinking when we're tired, and how much that's exacerbated with cognitive issues, right? 2% of cognitive changes can bring on what we call delirium. And so that's very, even for lack of dehydration, if they're forgetting to drink during the day, that can affect that, and exacerbate that as well. If they're agitated, they might remove a necessary medical device. This could be a walker that they forget that they're using. It could be compression stockings. It could be hearing aids, right? So it just get everything off. Let's go back to square one. And sometimes if they're forgetting that they need those to function better, it's going to impair their abilities even further, unfortunately. And lastly, increased agitation or violent behavior can result in injury to themselves or others.
Okay, it's time for another poll question. Audience, it's a true false. Sundowning syndrome behaviors are always harmless. Is that true or false? Sundowning syndrome behaviors are always harmless. True or false? Everybody go ahead and weigh in. And as I've mentioned before, if you're having any trouble at all, just go ahead and put that answer into the chat box so that you can get credit. All right, we'll give it just a couple more seconds. And we will close it and release our results. And it looks like everybody got it right. So great job, audience. And back to you, Erin.
Thank you. Okay, so now we're going to look into some ways of help, right? So, how do we help prevent sundowning syndrome? So in the environment, what can we do? Maximizing exposure to light early in the day to encourage nighttime sleepiness, helping to keep that circadian rhythm going in the right direction is very important. And we'll look at that more in depth on another slide as well. In the late afternoon, reducing background noise and stimulating activities. So, something as simple as lawnmowers, right? Lawnmowers can be a big trigger, or if you live near the airport, planes flying overhead might be something that someone enjoyed. And all of a sudden, they need to get inside and stop their gardening because it's just too much noise. Um, Bringing familiar items for comfort if the environment is unfamiliar, right? And so I always tell families, hey, you've got that favorite pair of jeans that just when you've got them on, your day is going to go a little better, or you can overcome anything, right? So making sure that clothes are comfortable, maybe in the evening time, their favorite pajamas, buying a couple pairs of something that they love, that comfy sweater, that blanket or comforter, really makes a big difference in how we are going to react to the world around us. If we feel like we're warm and snug and got our slippers on, might make it a little bit easier for us to get through this. And then, as we've mentioned before, removing clutter is a big one, right? Clutter means that something's unresolved, and that's going to create anxiety, especially in women who like to clean up, but also in men as well. Like a cluttered desk is going to feel like their work is unresolved, or they might need to tidy up their office. At the individual level, for preventing sundowning, here's some other interventions. So, maintaining predictable routines and schedules for bedtime, waking, meals, and activities. We want to try and be flexible with this routine, right, around their changing biorhythms. Sometimes individuals will completely swap. They'll be up in the nighttime and they'll be asleep during the day. And so that's something to try and work through with your physician to help see how we can help them reorient to the daytime. Might seem counterintuitive, but it's important to limit daytime napping. And we see this very often. I think I mentioned it earlier, where individuals who have cognitive impairment and dementias, they might reset their whole day, right? So taking a nap tells their brain time to go to sleep, and they wake up at 4 in the afternoon and they're ready for breakfast, right? Or they change into their pajamas and they want to shower and get ready for the day. And so helping to continue their cognition through the day and keep them on an even track of what would normally progress for them is really important. Limiting caffeine and sugar to the morning hours only, right? So the less stimulants we're providing in the afternoon time, that's kind of the winding down time. We want things to start slowing down, getting ready for the end of the day. Of course, limiting alcohol to reduce increased risk of confusion. And then looking for behavior patterns to identify what makes their symptoms better or worse, right? Their favorite music could be helpful. It might not be, but oftentimes it is. But noise from kids or from a TV that's too loud might be too overwhelming. And then other distracting activities. So trying to redirect to what's the favorite activities and foods, animal, and people. Long-term memories are usually more intact for longer during most dementias, right? So maybe flipping through a photo album of some of their family, or maybe going on Google Maps and going to the street level view and looking around their old town where they grew up as a child. Um, some things that are pretty easy to do and low stress. Some of the treatment options for sundowning syndrome, right? We always want to try non-medication interventions first. Nighttime sedation meds have an effect which can hasten disengagement and decline, and they're not recommended as a first line approach. So, some of the other options to that would be light therapy. So, exposure to fluorescent lights or daylight seated close to a window or outside in the early morning helps to stimulate awareness of the morning hours and the time of day. So, maybe having breakfast on the patio, and maybe you have it together, helping to regulate the sleep cycle and adjust sleep environment. So, cool and dark. Aromatherapy, so familiar and comforting smells like basil or orange, lavender. Physical activities such as going for a walk can also help improve sleep a lot at night. Music therapy, right? It's always comforting and engaging. And if you're trying to wonder what music is the best, the ages that are the most researched that seem to have the strongest effect on memory and comfort are from our ages 12 to 25. So that music that was in that time frame of their life between ages 12 and 25 is the most impactful. And so maybe creating a Spotify playlist, or they're having their favorite CD on during that time of day. If there's music that's tied to a really wonderful event, like maybe a wedding song or an anniversary, or some song that they used to sing to their kids to get them to sleep at night, those are often very healing and comforting as well. Sometimes just a healing touch, right? Sitting on the couch and just holding hands or linking arms or just being there. Not every second of the day has to be full. And sometimes just being able to sit in parallel and relax allows them to also know that it's an okay time for them to just try and de-stress and stay comforted and relax as well. Medication treatments, right? So just a reminder, we always want to make sure we check with the primary physician or neurologist to see if a medication can help. So I mentioned this earlier. There was a USC light study, daylight and dementia, that I was involved in 2018. So Dr. Kyle Konis and Dr. Ed Snyder from the USC Schools of Architecture and Gerontology, respectively, they studied a randomized controlled trial that was run at 8 Silverado communities in Los Angeles. And so our goal was to assess the effects of daylight on the mood and behaviors of residents living with dementia in long-term memory care communities. So some residents were sat in a room that had a certain level of daylight between 8 a.m. and 10 a.m. They were sat closer to the window. And then some residents were sat in a room that just had artificial light between 8 a.m. and 10 a.m. And so the research did show that increased exposure to daylight can reduce depression in individuals living with dementia. And so there's the clinical trial and the pilot study were released into publications, and you can see those here. And so a lot of senior livings are making sure that we have our dining room open. We want to make sure the blinds are open. We want to make sure there's a certain amount of light coming in, encouraging at home, especially when our loved ones are eating, that they're close to a window or even outside is always great, especially for breakfast. Might be a little chilly, put on a sweater, that's okay. But this really is impactful, that to help keep their circadian rhythm and to help reduce dementia, which is very important, and reduce depression and dementia. Handling sundowning. Okay, so once it occurs, this is it's the inevitable that's going to happen. What we do to try and help 9 times out of 10 might help, but that 10th time might just be a rough moment. And so that's what's important to remember, that it is a moment, right? We want to be calm. We don't want to raise our voice or touch them unexpectedly. We don't want to restrain them or disagree. Belittling someone can make the situation worse and provide them more anxiety and stress than before. If they are pacing, clearing a path for the person to walk back and forth and avoid arguing, asking for explanation, or rationalizing, right? So if you don't insist, they can't resist. Here's some helpful tips to try. So, turning on soothing music, validating their concerns, listening calmly to their confusion, trying to discover the cause of their behavior, right? So, this is what we call entering their reality. And it's really important to just ask questions, right? Well, I'm looking for home. Okay, well, tell me where home is. Well, home's in Ohio. Oh, okay. Did you grow up there? Yeah, well, tell me what it was like. Well, we lived on a farm and maybe now off you're onto a childhood story, right? So we're trying to see where they're at. And oftentimes, as we ask questions that are open-ended, we can get a better idea of where in time they think they are in their head. Sometimes offering their favorite food or activity, maybe holding their pet if they have one, or reading a book is helpful. And then trying to introduce maybe some new activities that are distracting, such as folding napkins, right? So at our MBK communities and in our memory care neighborhoods, it's really important for us to have engagements that are centered around things that we've done all of our lives, right? So those routines, such as washing dishes or having a station where we can fold towels, or maybe we're going to ask residents to help set the table for our dining room. Right. And so in our connections for living, which is our memory care neighborhoods, it's important that we help them reduce any stigmas for what they should be doing or what they can't do, right? They've been handling house activities and those are comforting, right? So if a caregiver wants to come and help them pull the sheet up and help them make their bed, we're going to walk them through that because they've been making their bed as long as they can remember, right? Since they were little. Other ideas to help handle this is to keep the area well lit, closing curtains so that the transition from light to dark can't be seen, and making sure that the lamps are on and that there's not excessive shadows in their room as well. It's also important to take care of ourselves and our approach. Our demeanor and our emotional affect has a huge effect on the person experiencing distress. So, taking a few slow, deep breaths before approaching them, having a calm, gentle presence. One thing I always recommend when I'm training families or care staff is the open palm approach, right? So if you come towards somebody, opening your palm means I'm not a threat. It means I'm here for you. It means I want to help and that I'm not going to move too quickly and that you're in charge. It's telling the person they're in charge and they get to help initiate what's going to happen next, right? We don't want to tower over someone. So if the person experiencing sundowning is having a difficult moment, it's important to try and sit at their same level, or maybe we kneel down and talk to them eye to eye. And sometimes it's okay too just to leave the room and give them a few minutes, right? If they're in a safe space and they're maybe in their living room or their bedroom and they just need some time to cool off a bit, that's okay to not continue pestering them to try and figure out what's wrong. Give them 5 or 10 minutes, come back and say, hey, how's it going again, right? And so you're going to start that fresh approach with calmer emotions, and maybe sometimes that will help, and maybe you'll get a little further in your conversation. So taking care of ourselves, finding little ways to distress throughout the day, right? So as their fatigue builds up as the day progresses, ours most likely will as well. So we try and ask if we can do things in tandem, right? So instead of saying, don't forget to wash your hands before you eat breakfast, right? hey, let's go wash our hands before we eat breakfast, or I have to wash my hands before I eat breakfast. Do you want to come? Right. So if we make this a group activity, then oftentimes it doesn't feel like we're talking down to our loved ones or those that we're caring for. And it helps them feel like they're part of their own decisions and not someone who needs dictating to. And then just keep in mind, especially if you're a spouse or a child of someone experiencing sundowning, that the roles are changing. And they used to be in charge. They used to have an equal say in the household, or they used to care for you because you were their child. And so oftentimes, that role reversal makes a big impact on them emotionally, and it's really hard for them to accept care sometimes from someone who's that close, who knows them in a different way. And sometimes bringing a caregiver in, or sometimes at a community, we've had families say, boy, it was so tough at home with mom, and here she's just a whole different person. She presents differently. She's putting on her best foot forward when she gets out of her room in the morning. And that's great because that allows families to get back to being the family again and not in that caregiver role. More than 90% of communication is body language and tone. So sometimes if we see our loved ones are getting frustrated, just check ourselves and think, okay, am I tense right now? Do I need to check in on myself as well?
Okay, we've got another poll question. Your demeanor and emotional affect can have a big effect on the person experiencing distress. Once again, your demeanor and your emotional affect can have a big effect on the person experiencing distress. Go ahead and choose your response, and we'll give it just another minute. And Erin, I want to give you a little time check. Okay.
Thank you.
All right. Looks like everybody's had a chance to, just about everybody. Give it a couple more minutes. Okay, let's go ahead and release the results. Looks like everybody got that right. Great job, audience. And back to you, Erin.
Thank you. All right, so as we wrap up here, let's go through quickly some tips for senior care residents and hospitals. So, environmentally, we can help minimize that flurry of activities during shift change by making sure there's somebody stationed there and helping to keep activities consistent. Reducing noise and disturbances at night so the residents can sleep, right? So, sometimes residents benefit from a white noise in their room to help with anything that might be going on in the hallways. And then providing familiar belongings or music to help provide comfort and reduce disorientation. Activities like meditation, massages, essential oils, these are all wonderful activities that can be done in the afternoon to help our loved ones wind down. Flexible schedules and rest, right? So, one senior community has all but eliminated so called sundown syndrome for over a decade by putting an end to the late day commotion and by instituting a policy of rest as needed that listens to their rhythm rather than an artificial schedule of rest and activity from Dr. Al Power with Dementia Beyond Disease. Entering their reality, we've talked about this. We like to call this therapeutic retelling in the industry, but just a reminder not to disagree with their view of the world. They're reliving the past. They think their kids are young. They might be losing them. Instead of trying to convince their kids are adults, we might ask, well, where would your young kids be right now, right? Young kids would be at school. They don't need to be picked up right now. Or if it's the weekend, oh, it's Saturday. I'm sure they're outside playing with their friends, right? And so just try and keep in mind, ask ourselves if we were experiencing their level of confusion, what would that look like? Assuring individual needs are met. So we want to make sure as care residences and hospitals for seniors that we're occupying their time with structured activities, making sure they're wearing their hearing aids, their glasses, ensuring they're staying hydrated and well fed. So providing snacks in between meal times is really important. And then if possible, just reducing any meds that cause extra confusion. And again, I'm at Kirkwood Orange. And so we have support groups, we have dementia education talks. And so please feel free to reach out about MBK Senior Living and about our community. And I'll hand this back over to Kim. Thank you
Okay.
all.
And why don't we go to the final slide then, Erin? Um, I think there's one more slide. Whoops. Oh, maybe not. Okay. Oh, there it is. Okay, before we get to the questions, it does look like we're going to run over everyone. So if you're able to stay, we invite you to do so. But for those of you that are getting CEs, you have to just be here for 60 minutes. So we do understand once the 60 minutes is up that you may have to leave. But before we get to the questions and answers, I just want to, of course, thank Erin. Erin, that was just fantastic. A lot of great new information about a, an old topic, so very, very
Thank you for having me.
very enlightening. Also want to thank our sponsors, O'Connor Mortuary, Care Choices, Hospice and Palliative Services, Caring Companions at Home, and of course, Alzheimer's Orange County. I want to remind everyone of our next CE webinar, which is the topic is the power of music in dementia care. And that we're going to have Justin Russo is the director of programming at the Institute for Music and Neurologic Function talking to us about that. And then I also have something I'd like to promote, which is an upcoming opportunity for all of you, if you're interested, to become a certified Memories in the Making art facilitator. So we have two opportunities. One is on March 26th and one is on April 30th from 9 till noon here at our offices in Irvine. So if you're interested in helping dementia individuals find joy and connection through art and would like to learn how to be part of that special program, please let us know and we'll get you connected to that. Okay, so got some questions here for Erin. Um, let's see. Uh, Is feeling cold all the time when no one else does a symptom of dementia? So that's not about sundowning, but just a general question about dementia.
I think that's just getting older. Sometimes as we age, our circulation declines, and so it's important to keep them nice and warm. Some people run hot, and we have residents who like their rooms at 85, and sometimes they need all the blankets and all the sweaters when it's, 80 degrees outside. So it just depends, but it's very common.
Sounds a little like our office.
Hmm.
Lots of different
Yes, ours
viewpoints on
too.
that. Is there a risk to touching if someone has a male caregiver? Have you had cases where there is sexual exploitation of a dementia person? Again, this is really not related to sundowning. Do you want to take a crack at that,
Sure.
Erin?
Yeah,
Okay.
I think it's always important, in communities, of course, at home, that we're always mandated reporters. So we train our staff to be very vigilant to check for any signs of that. But that does occur. It's very sad when it occurs. There's, it could be financial abuse or other types of abuse, and it's always important to report that as soon as you see it.
Yes, and if you need some help with that, you can call our helpline as
Yes,
well. You see the
please.
number there on the slide, so we'd be happy to talk to you further about that. Erin, at what stage does sundowning occur?
It normally occurs in the mid to later stages, but it really can occur at any time. And so you don't know if that will be for weeks or months or a period of time, but it does, as we mentioned, it occurs in one out of every five individuals experiencing dementia. So, um, It's good to be on the lookout for that and rule out anything that could mimic an infection like a UTI as well.
Yeah, I think people too should have a plan for wandering because I hear so much
Yes.
many times
Mhm.
from people that, oh, well, it's not a problem because my husband doesn't wander or my
Right.
wife doesn't wander.
Hmm.
So, and I always say, well, it's okay until it
It
isn't.
only takes once. Yeah.
Yeah, absolutely. Okay. Many caregivers confuse sundowning with general agitation. So how do you sort of distinguish between the two?
So, if you have a caregiver, it's important to take notes. And so, if they're at a community, they should report that to the medical technician or the LVN. If they're at home, they should report to whoever is the responsible party for that individual. And so, you can keep track of this. And so, that's important to note. Are they always behaviors that happen at 3 or 4 o'clock in the afternoon? Or does it happen throughout the day? And that'll give you a better idea. And of course, feel free to reach out on the helpline or reach out to your physician as well.
Thank you, Aaron. Um, Similarly, what are some early signs during the afternoon that sundowning, oh, I'm sorry. Yes, that sundowning may be developing that caregivers often miss. So what are some signs that caregivers sometimes miss when it comes to
Sure.
sundowning? Thank you.
I, I think packing up is a big one. Shuffling through your purse or maybe trying to pack clothes in your bedroom. Um, Being more restless and up and moving around more normally means their mind is focused on something they need to resolve rather than sitting calmly.
Yeah, that kind of sounds like this next question. Why is my husband fixated on his deceased parents during sundowning? So
Mhm.
that obsessive, yeah.
Yeah, so I mean the most intact memories we have are the long-term memories. And so our parents, we probably between our parents and our spouse have the strongest recollection. Every time we think about an individual, we put another memory in the bank in our brain. And so you have millions of memories about your parents. You might only have a couple million of your grandchild, but you have so many more of people who have been with you for a longer time. And so we find that they want to look for them, even if they've forgotten that they've passed. It's very common to bring up someone who makes sense to them and somebody who knows them the best as well.
Thank you, Aaron. Why is my, oh, wait a minute. Sorry. Do CNAs in nursing homes receive any training about dementia? This person is asking because her alert husband had a reaction to medication, and the nurse told her that he has dementia and was sundowning because it was the afternoon.
Yeah, so as a whole, state regulated communities or facilities, so skilled nursings, assisted livings, we have to meet regulations for dementia training. There's a lot of training that goes into that. A CNA could be somebody who is helping you at the home, so I don't know what about their background specifically. Um, but you're always welcome to ask for someone's background you can even ask the community or the facility what kind of training they provide.
Okay. And during the onset of dementia, should we openly use the word dementia and discuss sundowning with the patient?
I think that's a difficult question. Um, I think dementia has a lot of stigma around it. I think talking about cognitive decline, um, my best information to give families is feel free to bring it up once. However, they react should dictate how you move forward with that information. If they're very stressed out about it, then it's not worth bringing it up again, right? You've done your due diligence as the responsible party to share with them, just so that we feel like you can sleep at night. But ultimately, decisions after that should be for their benefit and according to how anxious they might react.
Absolutely. Thank you, Aaron.
Sure.
I think that's the end of our questions. So, I want to thank our presenter again, Aaron, so much for this great topic and for sharing your time and expertise with us.